Welcome to This Explainer. Today, we're diving into something that is absolutely crucial and honestly incredibly challenging: rebuilding hand movement after a stroke. If you, or maybe someone you love, is navigating this journey right now, you already know that just getting your hand to cooperate again can feel like one of the most frustrating hurdles out there. But we're going to break down exactly how to tackle this through a really focused protocol of 5 daily hand recovery exercises.
Before we jump into those exercises, though, let's tackle the fundamental question that's probably been on your mind: why is hand recovery uniquely difficult? It's completely normal to feel like your hand is just kind of lagging behind other parts of your recovery. There are very specific biological reasons for this struggle, and just validating that difficulty is our first step to actually overcoming it.
So, this is a real aha moment. Did you know the sheer amount of brain power your hand needs is staggering? The area of your motor cortex, which is the part of your brain that controls movement, dedicated strictly to your hand, is about the exact same size as the area dedicated to your entire leg. Why is that? Well, it's because your hand is incredibly complex. It's got 27 bones and around 34 muscles controlling just your finger movements. That's what allows for those beautifully precise actions, like playing a piano or threading a needle. But after a stroke, repairing that massive, dense neural network, it takes an enormous amount of work.
Okay, here's our roadmap for today. 1. Why hand recovery is hard. 2. Protocol rules and rest. 3. The optional warm-up stretch. 4. Wrist and finger extension. 5. Grip and opposition. And finally, 6. Functional precision and manipulation.
Section 1. Why hand recovery is hard. So, aside from that massive brain real estate we just talked about, there are 2 other huge factors at play. First, there's a golden rule in physical therapy: proximal stability for distal mobility. Basically, before you can get great movement at the ends of your limbs, like your hands, you absolutely need a strong, stable foundation closer to your core. Your trunk, your shoulder blade, they all have to be stable to actually support your hand. Second, it's just simple geography. Your hands and feet are physically the farthest body parts from your brain. That means there is literally a longer neural pathway required just to get the signal from point A to point B.
Section 2. Protocol rules and rest.
Okay, 300 to 800. That is your target for total session repetitions. I know, no way, right? That sounds completely daunting. But remember, you're not trying to build brute muscle strength right now. You're trying to rebuild neural movement pathways. Neuroplasticity, which is the brain's amazing ability to rewire itself, demands high repetition. So this isn't 300 reps for one single exercise, but for the entire session spread across the 5 daily exercises we're going to cover.
To actually make those hundreds of reps manageable, you need a solid schedule. You want to aim for 2 to 4 days a week, doing 3 to 4 sets per session. And here's the best part: you have flexibility. You can totally split this up. Do one session in the morning and another in the evening. But most importantly, you have to rest. Take 90 seconds to 2 minutes of recovery between every single set, and make sure you always take at least one full rest day between your working days. Your muscles and your brain desperately need that downtime to recover and adapt.
Section 3. The optional warm-up stretch.
Now, this stretch is a total game changer if you experience wrist, hand, or arm spasticity, which is where things tend to tightly curl inward. To temporarily reduce that tightness, take your unaffected hand and place it inside the palm of your affected hand, getting right up and under those fingers. Very slowly, gently bend the wrist and fingers back. Once you feel a stretch, hold it there for a solid 90 seconds to 2 minutes. As the muscles relax, you can push just slightly further into the stretch, maybe even doing a second round if you feel like you need it.
But actually, right before you do that stretch, or any exercise we discussed today for that matter, please remember this absolute rule: never push through any pain or significant discomfort. Always check with your doctor or physical therapist before starting a new routine, and honor what your body is telling you. We are looking for a gentle, productive stretch here, definitely not pain.
Section 4. Wrist and finger extension.
All right, exercise 1 is wrist extension. Why start at the wrist? Because unlocking the wrist can literally help unlock more finger movement down the line. So hang your affected wrist and hand over the edge of a table or even just over your knee. Then slowly try to raise the wrist up, hold it for a beat, and then slowly lower it back down.
The beauty of this protocol is how scalable it is. If you don't quite have that active movement yet, modify it. You can passively move the wrist back with your unaffected hand. Or try placing your hand sideways on the table to take gravity out of the equation, since gravity acts as extra resistance. Now, if you're ready to level up and make it harder, add some weight. If you have some grip, hold a water bottle or a can of soup while you lift. You could also wrap a cuff weight around your palm, or honestly just use your good hand to gently push down and create your own manual resistance.
Moving down the hand, exercise 2 is finger extension. Now, after a stroke, you might find that closing the hand to make a fist is actually way easier than opening the hand back up. This exercise directly targets that exact struggle. Rest your hand as flat as you can get it on a table. Try to raise all your fingers and your thumb up toward the ceiling at the exact same time, and then slowly lower them back down.
If getting your fingers flat or lifting them feels impossible right now, let's modify it. Use your other hand to push your fingers out and back, or, again, place your hand on its side to eliminate gravity's downward pull. Listen, even if you don't get full extension, that is totally okay. Push for whatever movement you can safely get. To make it harder, try lifting each finger individually while the hand is flat, or lay a light magazine or book across your fingertips and try to lift it using just your finger strength.
Section 5. Grip and opposition. Exercise 3 is grip and release. Start with your fingers open as wide as you can possibly get them. Then, close your fingers into a grip and squeeze as hard as you can for 1 solid second. Finally, slowly open your hand back up to that wide, spread position. I really want to emphasize the word slowly here. The release phase of this exercise is almost definitely going to be the most difficult part, so take it at a very patient, steady pace.
To make this one a bit easier, try giving your hand some sensory feedback. Ball up a washcloth, put it in your palm, grip it, and then see if you can slowly open your hand just enough to let the washcloth drop out. It's a fantastic visual cue. To progress this exercise, you'll want more resistance. Grab a stress ball or some therapy putty, really anything that pushes back against your grip so you're forced to squeeze harder.
Exercise 4 is opposition. This is the crucial movement that lets you pick up a coin, hold a pen, or button your shirt. Start with your hand open. Touch your thumb to your index finger. Then touch your thumb to your middle finger, your ring finger, your pinky, and then work your way all the way back to the index finger.
If touching every single finger is too much right now, no worries. Just practice bringing your thumb to your index finger. You can also use your unaffected hand to passively guide the thumb to each fingertip. Once you're ready for a challenge, try doing it faster, but keep this in mind. Accuracy and precision are way more important than speed here. Make sure you actually hit each fingertip. For building strength, you can use your good hand to wrap around the active fingers and pull outward slightly. That forces the working thumb and fingers to squeeze harder to stay pinched together.
Section 6. Functional precision and manipulation.
Exercise 5 is where we bring the whole shebang together. Gather about 5 to 15 small objects from around your house. Different sizes, different shapes. Pick up each item one at a time, but here is the absolute key. Hold it exactly like you might actually use it in real life. If you pick up a pencil, position your fingers as if you're getting ready to write. If it's a coin, pinch it like you're about to slide it into a vending machine. This directly trains your brain for the actual real-world tasks you need to perform every single day.
Now, if precision is still slowly coming back to you, use bigger objects to start, like a tennis ball or a large marker, and just focus on picking them up and setting them back down. To make it harder, go much smaller. We're talking grains of rice, beads, playing cards, or small screws. You can even add a placement challenge by picking an object up on one side of your body and transferring it all the way across to the other side. This is fantastic because you're working on hand precision, but you're also getting the bonus of full arm movement at the exact same time.
So we've covered the biology, the vital rules of high repetition, and the 5 core daily exercises to help you rebuild your hand movement. Look, it's a lot of hard work, but having a clear protocol is absolutely your best tool. I want to leave you with one final thought to keep you motivated on this journey. Think about your personal why. What small, everyday item are you most looking forward to picking up again? Keep that item right at the front of your mind as you start your reps. Thanks for joining me for this explainer, and keep pushing forward.